Hey Doug, welcome back. So we're going to continue on with 3 more assessments now. What we're going to do is we're going to measure your waist circumference. We're going to do a push-up test for musculoskeletal endurance, and we're going to do a one-legged stance test to test your balance. Do you have any questions or concerns about taking these tests today?
No.
All right, terrific. So the first assessment we will do is the waist circumference. Do you feel comfortable removing your shirt?
Sure.
I'll ask you to do that now. Okay. So what I'm going to ask you to do is stand with your feet about hip distance apart. Perfect. And just be as relaxed as you can be. Okay. So what we're going to measure is your waistline measurement. So I'm just going to find our landmark here, which is at your iliac crest. And just above that, here on the right side of your body. And I'm just going to make a little horizontal mark right here. Does that tickle?
That's fine.
Okay. So once again, I'm just going to ask you to relax your arms by your side. I'm just going to take this around you. Sorry if it's cold. And then, yes, oh yeah. Take it off there. All right. I'm just going to do a crossover technique here. Perfect. All right, I'm just going to make a note of that, and I'm going to take a second measurement. So mark that down here on your assessment sheet. And let's try that again. So once again, I just want to make sure the shorts are out of the way. Perfect. Thank you very much. Now just relax your arms. Beautiful. Good. Try this. Take a deep breath in for me, and then just exhale. Beautiful. Terrific. Great. Thank you very much. Okay. All right. Put your shirt back on if you like. Thank you very much. And just while you're doing that, what we'll do is we'll set you up for your next assessment, which is going to be your push-up test. So what we're doing with this test is testing your muscle endurance. So it's not a time test, nor do you have to move at a certain pace. I'm just what we're looking for is simply just how many push-ups that you're able to do in a row. Okay? So you have an option here to either use the mat, or if you feel more comfortable not using the mat, you're welcome to do that as well. Okay? The setup is going to be this. We're going to bring your hands underneath your shoulders. And then bring your shoulders over your wrists. Now, because you're male, we're going to have you do these push-ups from your toes. Right? So the push-up, we're actually going to start you at the bottom, and then have you push up from the toes all the way up. And then when you come back down again, we want you to come low enough so your chin touches the floor, but your thighs and belly are off the mat. And then go again. Right? And again, you can go at your own pace. We're just looking for you to complete as many as you can. Okay? If we lose technique anytime along the way, we have an opportunity to make a correction. If you do 2 push-ups in a row with less than good technique, then that's when we'll stop the test. Right? Remember too, you have an option to stop the test at any time, whether you're feeling any discomfort or whether you're fatigued. Okay? Any questions? Would you like to use the mat, or would you prefer just to work on the floor?
The floor is probably fine.
Okay, so we'll take this out of the way. So what we'll let you do is just start with kind of a couple of practice push-ups. So once again, come on down onto the floor. All the way down here. Now once again, before you come down, we just want to position the hands in a fairly narrow position. Once again, directly underneath the shoulders. Perfect. And then bring your body down to the floor. Right, so every time you complete an up and a down motion, that'll count as a full push-up. Do you want to just try a couple?
No.
Just want to go? Okay, there we go. It's 1. Yep, perfect. So each time, chin to the floor, but thighs and belly remain off the floor. 1. I want you to exhale. exhale and push up. Inhale and come down. Good job. It's 20. 25. 30. Good technique. 35. 40. Exhale and push up. Good, great job. 42, that's fantastic. Good job. Take a little bit of a break. I'm just going to mark that down. Really great job. How do you feel?
Tired.
Feel okay. If you'd like to, you can take a bit of a stretch. You came into a child's pose if you want. Come back for a quick little stretch. Or if you want to open up across your chest. Yeah. Good job. Really good work. All right. So just as you're recovering from that, I'm just going to set us up for our final assessment of the morning. All right, Deb, are you ready for our third assessment?
Yep.
Okay. What we're going to do here is a one-legged balance test. And what this does is literally test your balance. What we do know is that good balance tends to lend itself to fewer falls as we get older, and also lends itself to effective use or effective application to the activities of daily living. Okay? So what we're going to have you do, we're going to use the chair as an initial support. Right? Have you stand by the chair, beginning with your feet underneath your hips. Right? When you feel ready, I'm going to ask you to cross your hands over your chest. Right? And then lift one leg. Now again, if anytime you feel unsteady, you're welcome to place your foot back down or to reach for the chair for support. But again, we just want to make sure that you are as safe as possible. Right? Now, having said that, if the foot does touch down, touch the inside of the leg, or you do reach for the chair, that's when we're going to turn in the assessment. Okay? We're going to set you up, so we're going to turn you towards the mirror. And as you've seen, I've set up a marker at about your eye level, and that's where we're looking to keep your eye gaze through the eyes open section of this test. Okay? Do you have any questions? Okay. So let's begin. So again, remember the chair is here for support. You can choose whichever leg you prefer to start with. And when you're ready, go ahead. Once again, we just want you to keep with normal breathing patterns. Now this test will go to a maximum of 45 seconds. We don't need to discontinue the test first. Terrific. It's 45 seconds. Well done. All right. I'll give you a little bit of a shake that you can, and then we're just going to test the other leg as well. So just reset this. Do you need a moment, or do you want to go forward? All right. Okay. So whenever you're ready. Just ask for your foot terrific. Well done. All right, let's check out. Now we've got one more test each leg. And what we're going to test this time is eyes to closed balance. So the test is exactly the same. We're just going to ask you to close your eyes. Now it's normal for when we have our eyes shut for our balance to be compromised a bit. So you may or may not be holding the balance for nearly as long. But again, do sit yourself up so you're nice and close to the chair. It's there for some support for you should you need it. All right? Do you feel comfortable to come back and try the first leg again?
Yep.
Alright, as soon as you lift the leg and close your eyes, we'll start. Let's try the first side one more time. Okay, just whenever you're ready. Terrific, really good job. So sometimes it just takes us a little bit of adaptation. So sometimes that first practice round can be really helpful. Okay, let's try that second leg one more time, see how we do. Whenever you're ready. That sounds a little bit tired.
That's really good.
Oh, you did a good job. You did a great job. So once again, what we're going to do is accumulate all of the information for all of your assessments, and then we'll sit down and have a discussion together what the full picture means in terms of your health and fitness, and where we can move forward from here in terms of the program design for you. Do you have any questions about anything we did today?
No.
You did a great job. Thank you.